UnitedHealth is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, UnitedHealth is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits. With this web of subsidiaries, UnitedHealth is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker. That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned. Mr. Whitty.
Elizabeth Warren interviews Mr. Whitty in this video, who is the CEO of UnitedHealth. This was before the Luigi incident, but it still reveals the shady healthcare practices these healthcare insurers partake in.
Mr. Whitty, in 2023, UnitedHealth raked in a whopping $22 billion in profits, making you the most profitable healthcare company in the country. In fact, by revenue, UnitedHealth is the 11th largest company in the entire world. Now, Mr. Whitty, UnitedHealth Group owns the country's largest insurer, the country's largest claims processor, the country's third largest pharmacy benefit manager, a huge pharmacy chain. It is the largest employer of physicians nationwide, or controller, with at least 90,000 physicians, as you just testified. That's about 1 out of every 10 doctors in the country. Is that correct about your size?
Thank you, Senator. As far as the physicians are concerned, we employ just under 10,000.
Well,
and
as
the
I
rest
said,
are
I think
affiliated.
you have control over about 90,000.
I would say not control. They choose to work with us.
Okay. Great. Because UnitedHealth has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients.
I just want to quickly interject here. Elizabeth makes a very good point here. If you put doctors in a position where they are incentivized to make profit, then taking care of the patient's health is not going to be their main priority.
UnitedHealth is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, UnitedHealth is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits. With this web of subsidiaries, UnitedHealth is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker. That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned. Mr. Whitty, according to a 2019 investigation by the HHS Inspector General, UnitedHealth was far and away the most aggressive abuser of upcoding practices. Do you know how much, according to the Inspector General, UnitedHealth cheated taxpayers out of in 2017?
Senator, thank you for the question. I'm not familiar with that particular piece of work.
The number is $3.7 billion, and that's in just a single year, and that's from only 2 upcoding practices. Now, as we speak, is UnitedHealth under investigation from the DOJ for, among other things, your billing practices?
Senator, thank you for your question. We have a long-standing practice of not commenting on matters such as that or things like mergers and acquisitions.
Well, I understand why you might not want to comment on it. Public reporting from the Wall Street Journal confirms that it is, although your company has not disclosed this investigation. In fact, yesterday I sent the SEC a letter raising concerns about over $100 million in stock sales that UnitedHealth executives made in the days and weeks before the investigation was revealed by the press. And I'd like to make that part of the hearing record if I can, Mr. Chairman.
Objection, sorted.
Okay, so UnitedHealth is huge, and it boosts its multi-billion-dollar profits with, among other things, illegal billing tactics. And that takes me to the data breach. After the largest cyber attack on the healthcare industry in American history, quote, put hundreds of thousands of healthcare providers at risk of collapse, UnitedHealth is now using the crisis to expand its monopoly even further. For example, in Oregon, UnitedHealth tried to purchase a local physician practice, but faced enormous public opposition. After the data breach that we're talking about today, these doctors couldn't get reimbursed for their services, which pushes them to the financial breach. So, what did UnitedHealth do? They filed an emergency petition with regulators to allow them to acquire the doctor's practice on an expedited basis. Mr. Whitty, will this acquisition make UnitedHealth even bigger?
Senator, thank you for your question. I'd just like to also put on the record that we, as an organization...
I had a very simple question. Will it make UnitedHealth, this giant, this 11th largest company in the entire world, even bigger?
As new organizations join us, the organization, I hope, becomes better as new physicians, for example, join.
The question is not better. We've already talked about your business practices. The question is bigger. Will it make UnitedHealth bigger?
As we grow, we become larger, yeah.
Yeah, okay. So, UnitedHealth is using its own data breach to snap up doctors' practices that have been driven to the edge of bankruptcy by that same data breach. It's no wonder that UnitedHealth told its shareholders that this data breach would have, quote, no material impact on the company's finances. UnitedHealth will stop at nothing to grow bigger, bigger, and bigger as we speak. UnitedHealth is trying to pick the bones of Stewart Health Care in my home state of Massachusetts.